Poverty is not always apparent. In Ontario, 20% of families live in poverty. Poverty is a risk factor for many health conditions. Primary care providers are well positioned to identify and provide support to people living in poverty. However, many providers often report feeling ill-equipped to do so. The team at Center for Effective Practice has developed an integrated solution to support primary care providers and to connect those living in poverty with community-based resources. Here's how. Meet Sophie. Sophie has one child and has a part-time minimum wage job. Sophie has a difficult time paying her bills at the end of the month and feels isolated in her community. One day, Sophie visits her family doctor for a routine health exam. In the waiting room, Sophie completes a brief survey on a tablet. She identifies that she has difficulty making ends meet. She hasn't filed her tax forms. She has children, but doesn't receive the Canada Child Benefit. Sophie then sees her doctor. Her doctor's electronic medical record reminds them to talk to Sophie about the importance of filling out her tax forms and about the Canada Child Benefit. Her doctor then sets a reminder to follow up with Sophie about this next time she comes in for a visit. Her doctor also prints a customized resource handout for Sophie from Ontario 211. Sophie's handout includes information on community resources near her home, a tax clinic, and an early years center in her neighborhood. When Sophie visits the Community Tax Center, she learns that she's able to increase her income. Sophie also visits the Early Years Center, where she takes part in programs with her child, meets other local families, and borrows resources. Sophie is now able to pay bills more easily at the end of the month and feels less isolated in her community. She is certain this change will improve her health and the health of her child. She and her doctor feel excited about this outcome. Let's recap. This primary care system has integrated existing systems, supported primary care providers, and connected patients to community resources to ultimately identify and better support patients living in poverty. For more information and to download tools that might work for your primary care practice, visit effectivepractice.org/poverty.